had their potential parents of possibly gay, transgendered, or even heterosexual youth. One of the fears that you might have with either your child coming out or just your child growing up in general is, well, could they get AIDS? Could they be infected with the HIV, human immunodeficiency virus, and then get AIDS, acquired immunodeficiency syndrome? Well, but you have the power to stop it right now. Give me a moment. HIV is a fluid-borne virus, as in two fluids, or a fluid and a mucous membrane must come together in order for the virus to be transferred. This is why people emphasize condom use. But even more important than condom use is education. Knowing about the virus, knowing how it's spread, and understanding it. I have links below to educational material and statistics from the World Health Organizations, or several of the top organizations in the world when it comes to the actual scientific data on the matter. You see HIV being very widespread in third world nations. Do you know why? Lack of education, lack of testing, and lack of access to condoms and other barrier methods. And there's also quite a bit of stigma with the disease. HIV is just like just about any other sexually transmitted infection. Anybody can get it. But there are ways to reduce your risk. Using condoms, using dental dams, being aware, knowing your status, getting tested. Even if you have not engaged in behavior that could lead to infection, knowing your status, getting tested. I myself have never had relations with a man, and yet I've been tested. Just for the heck of it, As an adult, it's part of being an adult to know your status. It's part of being a healthy, knowledgeable person to know your status for sure. There are many places where you can get tested. There are a lot of free clinics. Knowing your status is part of that education, part of testing, part of condom use, which has actually been the key way to contain the virus. In the late 1980s, early 1990s, there was a massive education push, and a push for people to use condoms and know their status. And this is what contained the virus. This is what dramatically dropped the AIDS rate in the early 1990s, late 1980s. Unfortunately, with abstinence-only education, we did see a rise in the number of cases. But then again, we also saw a rise in the number of teen pregnancies during the early part of the 2000s. What it boils down to is that if your child is knowledgeable, be they a heterosexual or a homosexual, if they are knowledgeable about birth control methods, if they are knowledgeable about barrier methods like condoms, they will dramatically reduce their chances. A condom is 95 to 99% effective against preventing the spread of HIV. Those are pretty good chances. Those are statistically very strong chances. And the information link below will tell you more about that. But what it truly boils down to is clear, open, honest communication. Knowing the facts, using the facts. I know this isn't easy for you. But, always be open to listening. Always be open to accepting. And remember, it's your child. And you love them, right? Peace out.